Yeah, hi. Good evening. I am Dr. Jaideep Khare, endocrinologist from Bhopal. So, today we will be discussing about pregnancy and diabetes, which can be classified by several means, which is now one of the most burning topic right now. Because we know that pregnancy is something which is very crucial and we need to have very good outcomes in babies and mother so that the mother is healthy and baby is healthy in future. सो एंड वी नो हमको पता है ये भी कि डायबिटीज़ एक बहुत बड़ा विकार पैंडेमिक रूप ले चुकी है विच इज़ लाइक वन ऑफ द बिगेस्ट पैंडेमिक वी आर फेसिंग राइट नाउ and the prevalence of diabetes is increasing day by day in India and worldwide, which is something very alarming. So as the prevalence of diabetes is increasing, so the prevalence of diabetes in pregnancy is increasing, and there is something term called as gestational diabetes, which is called as diabetes which is detected for the first time during pregnancy itself. Its prevalence is also increasing. So it is something which is very need of hour to know about it and manage it properly so that the complications which arises because of the diabetes to mother to baby are prevented or can be reduced at least. So how do we define it? First of all, the first thing is how do we define it and how do we identify it, and then if we will not be able to identify it, then we will not be able to manage it. Once we have identified it, then only we can manage it. So any lady who is known diabetic on medication and planning for pregnancy, we know that she is diabetic. We should be cautious about her, and her blood sugars should be very under good control so that the conception happens and so that the outcomes are good. Now there is another term when there are conditions that lady has came to us that this they have conceived, and then some investigations were done and their blood sugars were on the higher side, and then they are worried about it. So outcomes, if we have to discuss about the outcomes, then those ladies, those who are diabetic, knowing about their diabetes, under good control, they have good outcomes. Diabetes ladies, patient living with diabetes, the blood sugars are not under control and they get pregnant, outcomes are poor. And similarly, when the patient is diagnosed for the first time with the blood sugars during pregnancy and not taking care properly, then the outcomes are poor. So how to make the diagnosis? In India, it is very difficult to get the patient should come to the practice nurse or to the hospital or CSC whenever they are diagnosing that they have conceived. So it is one of the most important thing that the patient should come or we should approach the patient. And whenever we are approaching the patient, their at least blood sugar should be checked. And once the blood sugars are checked, if it is on the higher side, then it should be immediately referred to the specialist, that is the endocrinologist, and the gynecologist should take care of the pregnancy part. So if the blood sugars are not very well controlled, what complications can happen? The first, we can define it into the maternal complications, fetal complications. Maternal complications can be during pregnancy, that the mother can develop hypertension, that which may be associated with eclampsias, preeclampsias. The baby size will enlarge because the sugars are on the higher side, that is called as something mega baby. The baby size is on the higher side, so the chances of cesarean increases and chances of normal labor comes down. And for the babies, thus if the baby size is high, then they can get stuck during the delivery part. There can be several syndromes which are classically called as infant of which can be classified as in the what so which can be classified as the babies of infants of diabetic mother. There can be cardiac diseases, there can be spinal diseases, there can be diseases with the nervous system. So these are the various complications which can be seen. So now, what is gestational diabetes? Gestational diabetes is something which is impaired blood sugars, which happens because of the insulin resistance. Insulin resistance, because of the hormones which increases during the pregnancy, causes insulin resistance, and the insulin which is produced by the body of the mother is not sufficient to control the blood glucose levels. So the blood sugars increases. So there are various criteria to identify it. WHO criteria, International Gynecological Society's criteria, Indian Gynecological Society criteria, like DIPSI criteria. So the best what for Indians we follow, that several times patient गांव से आ रहा है, मालूम नहीं है कि भूखा है कि नहीं है, कैसा है. So the best is whenever we are having first contact with the patient, at whatever time, give 75 gram of glucose to that patient, and after 2 hours again check the blood sugars. If it is more than 200, then patient is diabetic. Manage accordingly. Immediately refer the patient to the specialist. If the blood sugars are between 140 to 200, she is most likely to have GDM, and she should be managed with the according to the expert guidelines which are being given. We will discuss about that. And if the blood sugars comes out to be normal, then we should advise the patient to come again between 24th and 28th week of their gestation, because that is the time when the patient will have maximum insulin resistance and the blood sugars will be on the higher side. Suppose the patient has came on the 4th month, 24th week or 20th week, then we should ask them, if the blood sugars are normal, we should not say that you are not having GDM. We should say that right now your blood sugars are normal. You should come back around 28th on 24th week, because that time is the time when the insulin resistance is maximum, and that time we have to identify the GDM thing. But in India, several times patient has came in 12th week of pregnancy, and then they will directly come for the delivery. So first contact is important, and we have to sensitize them regarding their pregnancy and their blood sugar levels. Another criteria is international criteria, in which we have to look after the fasting blood glucose levels also. So if the fasting blood glucose levels are fasting, then first hour after OGTT, that is 75 gram glucose, and then second hour of OGTT. So if fasting blood sugars are more than 93 milligram per deciliter, then it is on the higher side and the patient is having GDM. Or the first hour blood glucose is more than 180 milligram per deciliter, then it is on the higher side. We should directly define that patient as a GDM. Then if second hour, if it is more than 153 milligram per deciliter, then it is GDM. Any one reading which is abnormal is classifying the patient as GDM, and they should be managed accordingly to the guidelines. Because pregnancy is like a 2020 match, it is very short period in which we have to manage the blood glucose levels very nicely, so that, as we have discussed about the outcomes in both babies and in mother, should be very good without any complications. Even if we are managing very nicely, then also there are some chances that some abnormalities may happen. So several times we need to have terminate the pregnancy a preterm, so that the complications are not increasing. So once we have diagnosed the GDM, so if the blood sugars are between 140 to 200 second hour, then what we say, that we should try with the medical nutrition therapy for 1 week. And if medical nutrition therapy is good and the blood sugars are coming down, it is good. But if a medical nutrition therapy is not sufficient and the blood sugars are persistently on the higher side, then medication should be started. And insulin is the gold standard treatment for the management of diabetes in pregnancy, whether GDM or previously known type 2 diabetic patient. Or because insulin is the hormone which is produced naturally in the body, and it doesn't have any complications. So, but our Indian patients are again different. They always want सब सुई का डर है, सुई तो नहीं लगवाएंगे, आप कुछ भी करें, they will keep changing the doctor several times कि कोई तो बोल दे कि हमको सुई ना लगाना पड़े, क्योंकि बचपन से सुई का डर डराया गया कि आप तेरी शैतानी करोगे, डॉक्टर के पास लेके चलेंगे, आपको सुई लगवा देंगे. So that fear is still in our mind, in our society. So several times patients don't want to have. So we can plan with the metformin, but under supervision of the expert. Metformin can be initiated, and we can monitor the blood sugars regularly, and we can monitor the size of the baby regularly. If the size of the baby is normal, fine, then it is good. We can continue with the metformin. But what guidelines say that after 20 to 24 weeks, metformin should be stopped. But in our practice, we continue till delivery, also even post delivery. So it has to be under the supervision of expert only. So once what medical nutrition therapy consists of, that we always say medical nutrition therapy, medical nutrition therapy. So in our practice, what we used to say that avoid sweets, avoid juices, have calories which is required according to your body weight. We calculate according to the body weight whatever calories is required. So we advise them, and have a high fiber diet, high protein diet. More of the protein should give the calories so that the blood glucose levels are not increasing suddenly. This is and if the patient is advised, not advised for bed rest, that several times there are complications, so gynecologists advise them for bed rest. So if bed rest is not advised, then some mild exercise should be done. Minimum 30 minutes walking is good. But if a bed rest is advised, then it is a completely different scenario, and we have to control blood sugars by medical nutrition therapy or injections only, insulins. So several times it is very difficult for the patient to come here, to come to experts. Then the physicians, those who are working in peripheries, they should start with the insulin. And what our guideline says, that if blood sugars are on the higher side, that it is more than 200 to 250, then start with 6 to 8 units of insulin. If it is pre-mixed insulin, because if they are in peripheries, the chances are there they will not be getting the good quality, higher qualities of insulin. So they can start with the premixes, which is the old time tested insulin, and 6 units can be started. Then after every 48 hours to 72 hours, the blood sugar should be monitored, and we should increase the dose by 2 units every third day, so that we are reaching the total dose of approximately 10 to 20 units in a day. And once we reach the insulin dose of 10 to 20 units per day, and still the blood sugars are on the higher side, then it is important that that patient should be referred to the specialist on urgent basis, because that patient is having severe insulin resistance. तो यहाँ पे फिर आपको डराने की भी जरूरत है कि यदि 20 यूनिट्स इंसुलिन लग रहा है, then we have to, because several times patient will not be willing to go to the higher center कि नहीं साहब हम अपना गांव छोड़ के नहीं जा सकते, हम यहीं पे कर दीजिए, कुछ कर दीजिए. Then we have to explain them, we have to explain it different way कि आप नहीं जाओगे तो आपका बच्चा खराब हो जाएगा, आपको प्रॉब्लम हो सकती है, आप मंद बुद्धि बच्चे को हमेशा रख सकते हो क्या. तो we have to be several times very rude also to the patient कि then only they understand several times कि we have to explain them. Actually, we want their good. That's why we want them that that patient should be referred to the endocrinologist, and it should be managed at higher center only. And once the blood sugars, and it is very short period, within 2 to 3 weeks, we should be able to achieve good glycemic control, because every trimester is important and every month is important. It is just like T20 match, every over is important. And any difficulty, any time the blood sugars, if they are more than 70%, 30% times abnormal, like they are going down or they are going up, then it will be very harmful to the baby and to the mother also. And hypoglycemia, because once we have started insulin, there are chances that the patient may go into hypoglycemia. And hypoglycemia is defined as when sugars are going less than 70 milligrams per deciliter, or the patient is having symptoms of hypoglycemia like severe sweating, severe breathlessness, palpitations, and letharginess, and even loss of consciousness. That time, immediately some glucose should be given to the patient, and so that fetal outcomes are good. And minimum, what there is something called as rule of 15. 15 gram of glucose should be given immediately orally if the patient is conscious, or around 30 50 ml of glucon D powder, dextrose, 10% dextrose should be given immediately IV if the patient is unconscious. And if the patient is having again second time of hypoglycemic episode is happening, then again the patient should be advised to be referred to the higher center, because there are chances that their insulin resistance is not similar, because sometimes it is high, sometimes it is low. That is called as brittle diabetes, and it has to be managed very cautiously. So GDM is important, and management is not very difficult. And if managed properly, then the outcomes can be improved by 100 times. What we say right now in India, the infant mortality rate is approximately 30. But if the patient is diabetic, then it goes up to 60, 70. And once we are controlling the blood sugars nicely, then that complication rate or mortality rate comes to 40s and 50s. It is not still touching the normal which is seen in our Indian population. So GDM, gestational diabetes mellitus, or type 2 diabetes with pregnancy is an emergency situation which should be managed under the guidance of an expert, that is an endocrinologist, so that the complications can be managed properly. Thank you for patience hearing. And I will just say here, as our guidelines say, whenever we are getting the first contact with any pregnant lady, we should get the blood sugars tested for that lady, because the follow-up rate in Indian patient is very low. They generally just come for one time, then they will directly come during the delivery time, and that time some severe complications must have happened, and then they will start creating nuisances in the hospital premises कि हमारे baby को हो गया, mother को हो गया. They will not think about the things that they have done, whether they have done good follow-up or not. So we should be now good counselors also. The doctor should be good physician. They should be able to manage it properly so that the complications can be reduced. Thank you for patience hearing. And if any questions, we can definitely discuss about those. And you can put your questions in the chat box portion here. Thank you.